The long and varied history of mental institutions reflects changing attitudes towards mental health throughout America. From their beginnings simply as places to keep the insane out of the public eye, to their current state as centers for rehabilitation, mental institutions have evolved along with society. A history of terrible conditions in mental institutions contributed to the development of the modern psychiatric hospital. In the 1800s, mental illnesses were not considered curable disorders, and sufferers were locked away in what served as the first mental asylums. They were referred to as lunatic asylums and consisted of what essentially amounted to prisoners who were beaten and left to live in their own filth far away from society. These terrible conditions caught the eyes of reformers like Dorothea Dix. As a young woman, she went overseas to England, where she observed the humane ways in which they treated the mentally ill. This stuck in her mind when she later became a teacher in a men's prison and noticed all the inmates that were actually sufferers of mental disorders. She traveled across country visiting lunatic asylums and gathering information for her eventual speech to Congress. In the speech, Dorothea attempted to advocate for the mentally ill, trying to get the government to allocate federal resources, including 12 million acres of land, to the care of the disabled. Congress actually approved this, but unfortunately, Franklin Pierce, who was president at the time, vetoed it.
I come as the advocate of helpless, forgotten, insane men and women, of beings sunk to a condition from which the unconcerned world would start with real horror.
In 1841, around the time of Dorothea Dix's activism, almost anything could get a person locked up in a lunatic asylum. This was especially tough on women whose husbands could have them declared lunatics at any time. Generally, if a woman behaved at all outside what was considered appropriate behavior for the time, she could be locked away, and her husband would often have an obituary printed for her and marry a younger woman. While it was easier for women's husbands to lock them away, there were plenty of strange reasons for people of all genders to be declared insane. These reasons included intense study, want of employment, use of tobacco or opiates, dread of poverty, grief, or religious excitement.
So what is she in here for?
Something about religious excitement. Despite the efforts of reformers like Dorothea Dix, it wasn't until the 1950s that people actually attempted to cure mental disorders rather than just locking sufferers away. The development of various antipsychotic medications, which made patients docile, allowed doctors to focus on surgical methods of intervention, like the lobotomy. Transorbital lobotomies involve a doctor entering a patient's brain through their eye with an ice pick. It's a relatively unpleasant procedure that essentially renders the recipient a vegetable. A doctor in the 1950s might also drill holes in the back of a patient's head in a surgery known as a leucotomy. These procedures were incredibly common for a couple decades, despite having very well publicized negative effects. With the invention of new medications and procedures, it became clear that America did not need to have as many people institutionalized as it had. That, in combination with the failed lobotomy of a family member, led JFK to sign the Community Mental Health Act into law in 1963, drastically decreasing the number of people in mental institutions. Unfortunately, these people often had nowhere to go afterward, and it led to some seriously ill people winding up on the streets. The effects of deinstitutionalization can still be felt today. Many of the people in America's prisons are mentally ill, and a large percentage of those people wind up in solitary confinement, where their lack of interaction with others only serves to exacerbate their conditions.
Mr. President, I have the Community Mental Health Act for you to sign.
Oh, fantastic.
In the 1970s, people began to question just how accurate psychiatric diagnoses were. Dr. David Rosenhan set up an experiment to test this. He sent people into mental institutions claiming to be having auditory hallucinations. These hallucinations were of someone who was the same gender as the participant, who said words like thud and empty, as if to allude to some sort of personal crisis. Once admitted, the subjects would act completely normal and claim they were fine. However, it often proved rather challenging to get out of the institutions, with most people not being released until about 20 days after they were admitted, and only on the condition that they took antipsychotics and admitted to having a mental illness. It's rather eerie to think about and made for bad press when the results of the study were published.
Oh, hello, I'm Dr. Rosenhan.
Nice to meet you.
So you're going to go in as a patient into this mental institute, and you're going to pretend you're hearing voices, and that's what you're going to be telling the doctors, okay? Does that sound good?
Perfect.
So, what kind of symptoms have you been experiencing?
You know, to be honest, I feel fine, but people are saying I'm hearing voices, hearing voices, but I'm hearing everything.
All right. Maybe you're gonna want to come with me? Look, the patient is insisting that she's fine, but I'm not buying it. She's crazy. Look at her. So what does the modern mental institution look like? Well, now they're commonly referred to as psychiatric hospitals, where doctors combine medication and various forms of therapy to help treat patients. Having a mental disorder has become a lot less taboo in the modern era, and diagnoses have become more accurate, so significantly less people who don't need to be in psychiatric hospitals end up there. But what does this mean for the future? It's highly unlikely for things in this field to simply plateau. Will people actually find cures to disorders like schizophrenia, and mental institutions will become a thing of the past entirely? There's no way to know what's coming next, but based on the previous trends, we can assume that it'll only help those in the mental health community. So what will the future of mental institutions look like?